welcome back to my channel. This is Dr. Dress Doll Official. I'm coming to make a quick update with you guys. I am almost 7 weeks post-op. I do still have some swelling. As you can see up here, a little bit around here. Definitely down here. Now it is that time of the month for me, so I feel like I have a little bit more swelling as compared to last week, but there is still some swelling regardless, even if it wasn't that time of the month for me. Right here, no swelling. All the swelling in my back and around my butt has gone down. My butt is back nice and soft. My massage therapist has really been working great with the lumps that I had got. Dr. Dress did a very aggressive, what I feel like aggressive lipo to my flank area. So it kind of left me with, well, not from what he did per se. It's just the natural, what happens afterwards. You kind of get these lumps, and that's why your massages, ladies and gentlemen, is so important after liposuction. Those massages, my massage therapist is the truth. Her methods are great. These lumps have just melted away. She really has helped my shape of my back, my lower back. She's getting my tummy tuck scar. So this tummy tuck scar gets, the scar tissue gets kind of hard, especially after surgery. Her methods, my tummy tuck scar is getting a lot softer. So I am just very happy in conjunction with my massage therapist and wearing that faja. So the only reason why I'm out of my faja right now is because when I wake up, I take my faja off, I do my hygiene stuff, and I get right back in that faja. I live in that faja. In fact, I had ordered one off this website. It was too big. I finally just got the store credit back for that. I have bought one here in Vegas. And actually, I bought 2 here in Vegas. One I had bought before surgery, just to, to help shape my how I was before surgery and clothes. And then I bought one after surgery. Well, the 2 that I have, the one before surgery, I got that altered. That was not cheap. And then I bought a faja from the same place I got my faja altered. I bought another faja. Both of those, I am already in the 3rd hook. So basically what that means, I'm going to compress as much as I'm going to compress. There's really no more to compress once you get past that last hook. And like I said, they are not cheap. So this faja game is, serious. This faja game is real. I'm happy that, it's, my shape is, really coming along. I'm compressing. I'm really, really happy, in that aspect. But it's time to either get them altered again, or, I'm going to use my store credit and get another faja, because I'm not really compressing as tight as I want to be compressing. And so I will in the future be making a video on my overall experience with with pre-op, surgery day, and after surgery, because that's going to be a little longer video, and I want to be very thorough. So stay tuned for that. But yeah, I want to just do some quick measurements, check in with you guys. For there's quite a bit of people asking on the different platforms on social media, am I happy, am I satisfied? I guess I'm not really sure. I guess there's some unhappy dolls with Dr. Dress. I have come across 1 or 2 of them, and that is very unfortunate. Myself, I'm a registered nurse, so couple things with that. One, I have seen firsthand how surgeons can be, they could do something really, really good, and then with another patient, it's well, that's not their best work, So I get it, I see it. And then number 2, I did have some issues with my belly button which I guess is normal. Normal, not normal, I guess, depending on who you're talking to. My belly button had opened up considerably. It had completely opened up, and you could see all the way through my, all the way through the abdomen. It looked like an abyss. You know what I mean? And it was looking really gnarly. It was a little bit pussy, a little bit, not too much, but it was a little bit, just, I had to be on antibiotics for 10 days. So, I just did what my nursing instincts, told me to do. And with the general surgeon I had spoke to here in Vegas, because I could not get a hold of Dr. Dress or his team afterwards. We'll talk about that in another video. So I just did like a wet to dry dressing, cleaned it, with normal saline, wet to dry dressing, covered it up, left it alone. I did that for about 2 weeks, and it's completely closed. It's completely healed. I don't know how much you guys can see on video. Yeah, it's completely closed. I'm very happy with it now. So anyway, getting back to it, that was about the only issue I had after surgery that was concerning. But I know some other dolls that happened to, not even with Dr. Dress, just different dolls that's had tummy tuck surgery. That guess that's a possibility. So, I feel also too, I wanted to also, I know I'm trying to get this measurement, but I also want to take note too, or just to explain to you guys, or just tell you guys, if you're doing a surgery, it's so very important after surgery that you maintain your cleanliness and your hygiene, right? Anytime you go to touch your incisions, your belly button, whatever, the open, your lipo holes and stuff like that, get gloves, wash your hands, get gloves. If you have a loved one, or a friend coming with you, make sure they clean their hands, they wear their gloves before they touch you. I am still like this, even though I'm 7 weeks post-op, right? When I have one part on where the, at the end where the sutures, kind of come out, early on in my surgery, I had accidentally ripped I know that sounds horrible, ripped the tape off. It was an accident. My foam had got stuck. And so I had like this little raised area that I had caused. So it's gotten a lot better. Maybe another video I'll show you guys, because I got it bandaged up right now. It's gotten a lot better. It's closed. But still, you know what I mean? I still am, nursing it back to health. You know what I'm saying? And I still wash my hands. I still put gloves on, cleanse the area. I cannot stress that enough. Guys, you guys have to be really serious when it comes to maintaining your hygiene, especially when it comes to touching these open areas on your body, because that's how infections happen. That's how you prolong your healing, and just a whole bunch of other stuff, right? So anyway, that was my little TED talk. Thank you for listening. But anyway, let's get into it. So my waist, very happy. So before surgery, I think my waist was like a 45 or 44. Right after surgery, I think I was a 35. So I lost like 10 inches, off my waist right after surgery. Now that the swelling has gone down considerably, like I said, I still have some swelling in this area. The swelling has gone down considerably. I think I'm about a 32. Sorry, guys. Okay. Okay, there we go. So I'm about a 32. There we go. Sorry if it's kind of hard to see. There we go. So I'm about a 32, right at a 32 in the waist. Very happy with that. So like I said, I've lost even 3 more inches since right after surgery. I think I said it was a 35 off the table, but 32 now. my waist. Now, they say there's this fluff fairy that's going to come and see us dolls, especially the ones that have the BBLs, hopefully in about 3 months here post-op. Because I've noticed right after surgery, right off the table, my butt went from before surgery, 40, 44, yeah, I think I was like a 40, maybe a 43, because I remember my waist was a little smaller than my butt. Yeah, I had a booty do. So, right after surgery, I was like a 47 or a 46. Nope. I've lost some inches there. I am like a 43 and a half, depending on where. 43 and a half. Right. Yep. 44 on a good day. Depending on where I take the measurements. You know, I try to get 43 and a half, right? So, yeah, lost some inches there. But you know what? If you look at my before photos, I don't know if I mentioned already, I know a few dolls asked, you know, am I happy? Am I satisfied? Yes, if you look at my before photos and look at my photos now, you will see why, yes, I'm very, very, very happy, very satisfied. Of course, there are some areas where I feel like, you probably see it on the camera, right? Like where it kind of dips in. You know, I kind of feel like that's how my butt was, like before surgery. You know what I mean? Where I feel like maybe it could have been filled in better. But that's the thing, though. Right after surgery, you know, it was filled in. And then maybe 3-4 days after surgery, I noticed this dip starting to happen. So, ladies and gents, listen. Stuff like that can happen. A lot of dolls will get into like, oh, you know, he did uneven work, or he or she did uneven work. I'm dissatisfied, you know. Depending on how you were before surgery, for example, me, very overweight, BMI was a 30. I did not work out, okay? So the muscles, my foundation, my muscles, okay? And I've also had 4 babies, okay? My muscles, right, especially in my butt area, are weak. You know, I had a very flabby butt. The fact that, okay, I have a cuff, right, and it's not flabby. We got some, you know, we actually got some volume, some nice volume is great, okay? The point is that the muscle, right, that muscle underneath the fat, sometimes is too weak to support the fat that is injected there. So sometimes, you know, a lot of times people, you know, us dolls don't understand that, right? And it's not at the fault of the surgeon. It's just our bodies, right? That's why it's so important, you know, one, wearing your fajas, compressing, molding, and most importantly, when you're healed and you get the okay go, get in the gym, right? This is not a you know, like, oh, you had surgery, blah, blah. We have to maintain these results as well, you know what I mean? So I'm hoping that, you know, between my massage therapist doing the different methods that we haven't started yet, but doing the different methods of, you know, lifting this butt up area up, you know, because the fat is there, as you can see. It's just my muscles are weak. And in conjunction with me getting in the gym and working out, we should be able to fix this, right? So, yeah, so I'm still very happy and satisfied. But to make this video not any longer, it's already almost 15 minutes longer. If you have any questions and you want to reach out to me, please do so. Yeah, I think that's pretty much it, guys. I just want to do a quick update with you guys. Yes, definitely reach out with your questions. I'm here for you guys. And yeah, you guys have a blessed week.